Good morning to you. And in a way, I don't want to wish you any bad luck, but I kind of hope your back is hurting a little bit this morning, because I think when you're through watching this program this morning, at least you'll have a little bit better idea of how's come the dumb thing hurts. Dr. Walt Pierce is our guest this morning. You may remember Dr. Pierce from the last time he was here, when we looked at your marvelous machine and what it did in the world of chiropractic. That's become a heck of a tool. And I understand you're now going international with it.
Yes, we are, Don. We now have one of those x-ray machines down in Mexico. We have some in almost every state in the Union, and we expect to have some in France and Japan within the next couple months.
The thing I remember about it most, Doc, was that it took about 1/10 as much radiation as the old machine used to look at your feet. Remember?
Well, actually, it's way less than that. We've had it tested by the state, and the machine can actually be used for 10 seconds, and it'll only use 1/3 as much radiation in 10 seconds as it normally would in 1/20th of a second on a regular x-ray machine.
Oh, my. We have a picture of it. I forget what do you call it?
We call it the spinal visualizer.
I see. And where do I stand as we're looking at that?
Well, when we look at that picture, you stand in between those two tubes.
Oh, I see.
The one on the right is the magnification tube, and the one on the left is a regular x-ray tube. And the patient will stand in between that, and then the exposure will be made. But the nice thing about this machine is the patient can be moving.
Yeah, now it's like not like a fluoroscope. Yeah, it is like a fluoroscope.
It's basically like a fluoroscope, but the only difference is we have a magnification tube in behind that multiplies your x-ray factors.
And I forget why we've needed that kind of a machine, Doc.
Well, as the spine becomes subluxated, or that means when they get out of line, then the vertebrae actually lock. A vertebra should move through certain motions, and if they don't move, then we find that which we call them locked vertebra. And as we have made a system that shows us how these spines should move, each vertebra, and if they're not moving that way, then that causes pressure on nerves. And then this is what causes problems and ends up causing disease in different people.
We talked about whiplash last time.
Yes.
Well, alas, poor Yorick. We've got to get... Why are you talking when you don't have your spine, Doc?
Here we have our spine with us this morning, as usual.
We were talking about up here before.
Yes, that's the cervical. The neck area is called the cervical, and that's what we discussed, I think, last January when you was a program. Yeah. And we never did get down to the pelvis.
No, because whiplash is a biggie.
Absolutely. We feel that 96% of the problems of the spine do come from the neck.
Okay, yeah. Not backache, though.
Yes. Many backaches come from problems in the neck. See, the important thing about the spine is the neck is the closest to the brain. And, of course, all the nerves come from the brain, and they travel down through the spinal column. And the cervical vertebrae are much more movable than the vertebra down here.
Okay.
So it's much easier for them to subluxate or get out of line. Now, a lot of times, if you have 2 or 3 different accidents, the first accident will be up here, and then as the muscles of the lower back weaken, and then you do any heavy lifting, then you have a secondary condition. But 96% of the primary causes of spinal problems come from the neck. You can have a condition called sciatica, where you have pain going clear down to the toes.
I've had that from a blow. Fell down the steps once.
Well, see, when you fall down the steps and things like that, the neck is the most easy to subluxate.
Okay, but boy, I remember I couldn't get up, and I hit right here.
Right, well,
on a step.
As you hit the lower back, a lot of times these vertebrae are all connected, just like dominoes.
Yeah.
And whenever you hit down here, it's easy to subluxate a vertebra up in the cervical spine.
Chiropractic is an old system of thinking about an emphasis in medicine, yet what you've done, I'm proud to tell you, is very new, particularly with the machinery. You now got a new table that you're using.
Well, the chiropractic started in 1895, and that was the same year that the X-ray machine was invented. And the two of them have really worked hand in hand. And as chiropractic has progressed, the X-ray machine has progressed. And our new X-ray that we brought out 3 years ago has really put chiropractic in the 21st century.
Yeah. Now, let's leave York, alas, for a minute. And I want to look at this because this scares me. I'm over here in this part, Doc. Oh, Harry. This is the subluxation degeneration, which means sub meaning under.
That's right.
Lux meaning
dislocation.
Okay.
A subluxation is something less than a dislocation.
Okay.
And this first one over here shows approximately what the normal spine should look like, right there. And then number one, phase one, that's when your first subluxation comes, and that can come from birth. You can actually have your spine injured at birth, and then it starts reversing its curve. See, the normal curve should go to the front. And as the subluxation progresses, the spine starts reversing. And this is what we talked about in another program. And if nothing happens to this, then the spine will start going under a degeneration process, and the disc spaces will start becoming very, very thin, and they will hook together. And this process is known as osteoarthritis. And as this phase continues, the spine will continue to turn back, the disc spaces will degenerate, and as you continue, then the spine will start fusing together, which means that one or two of the vertebrae will become one vertebra.
Now, let me have that just a minute, Doc, because we can show that as it looks like on an X-ray on the bottom of each of those. Hold that tight, and the cameraman will take care of the rest. For instance, now this is the X-ray of a normal
That's near normal spine.
Okay.
And then we go through the phases as the spine starts degenerating. And then the spine, the disc spaces will degenerate, and they'll actually start fusing together. Those little spurs on the out will start on the front of the bodies first, over in here.
Okay.
And then the disc spaces will totally disappear, and instead of being 3 or 4 vertebrae, it becomes one solid mass. And when a patient gets to that extent, there's no longer any type of help. It's just a matter of giving him relief. Now, if you can get this patient in their first phases, then it's possible to correct these.
In other words, would it be possible to prevent that fusion?
Absolutely. The last time we was on your program, we showed you the pre and post x-rays of the cervical spine, which shows the fantastic changes that can be made if that spine is gotten right away. Chiropractic actually should be a lifelong program. Now, I don't mean that you should have to go to a chiropractor every day or 3 or 4 times a week. In fact, I'm against that. There's never been anyone sick enough to go into a chiropractor's office 4 and 5 times a week. This is one reason why I'm glad that you do let me come on your show occasionally. I think it's important that people understand that there's a difference in way chiropractors practiced. There's people who still practice them back in 1912, and there's people who's practiced in 1987. And I'm sure these chiropractors that practice 1912 methods don't drive to work in 1912 cars. But as life progresses, chiropractic has progressed. And it always is a problem to me when I hear of people going into chiropractor's office, and if there's 5 members going, they each get the same type of care. The care should be patterned for you, and there should be able to see pre and post x-ray changes. In other words, if a person's spine is starting to reverse, if the proper adjustments are given, that spine can be brought back to look like the normal picture that we showed here.
I remember last time when you were talking about the planes in the neck bones.
Absolutely.
This way and this way and this way.
Absolutely. And whenever it comes to adjusting, nobody ever needs adjusted where they're... The old type of chiropractic is where they would lay a person down and twist both hips in both directions. But as we discovered and progressed with chiropractic, we find that vertebrae don't move left and right, nor can anything else move left and right. So a person doesn't need their back twisted both ways. When your back is being twisted both ways, this is a guessing type of chiropractic, and it just has no place in the modern chiropractor's office. A chiropractor should be able to show you exactly what's wrong with you. He should be able to explain what he's going to do about it, and then he could show you that he did do it by taking pre and post x-rays. If there's no changes being made on the x-rays, then that means that there's nothing being done. The spine's just no different than an automobile, actually. Like if you take your car into a body shop after it was in an automobile accident, you expect to see change. Well, when you take your body into a chiropractor, you expect to see change. If a person fractures a bone and they go to a medical doctor or an orthopedist, he'll take an x-ray and he'll say your bone is broken. And then he will set it. Sometimes you'll have to pin it, but then he can take a post x-ray and show the realignment. And then 6 weeks later, he can take another x-ray and show that that fracture is healed in its normal alignment, and then they'll give you some physiotherapy and such, and the arm will be as good as new. And chiropractic is the same thing. A subluxation is something that you can see. It's something that you can prove exists, and you can also prove that you can correct it. And if a person is just twisting the patient's neck every time in both ways, then he's guessing. And the chances of this spine ever getting corrected are very, very slim. Now, he might get a lot of relief. I'm not saying that.
Oh, yeah. No, it has happened, yeah.
Relief is one thing. Correction is another thing. And when you talk about chiropractic care, it should be something that starts after a person is born, and they should be checked. I don't mean adjusted. There's no such thing as a regular chiropractic adjustment. A chiropractic adjustment should be given only when you can prove that there's something existing. To get your back this cracked on a regular basis without any rhyme or reason is not what chiropractic was designed to do.
We'll take a break on Talking Pittsburgh this morning, and then we're going to get into lab work and look at some x-rays and look through things to see what Doc's talking about when he says you've got to see if something works or not, and you have to see results. That's what we'll do next on Talking Pittsburgh. Please stay with us. I just can't resist this pun. This morning we're boning up on chiropractic. No groans? Anyway. With Dr. Walt Pierce from Gravosburg. He has a book, I guess, that you give out that tells about chiropractic, A New Beginning, by Chirp Incorporated. Who's that?
Chirp Incorporated is one of the corporations we have that sells chiropractic equipment.
Oh, I see. Yeah, it's a corporation, yeah.
Yes.
And in case you're interested in this, the terms, what it is, and so forth, and the goals, and you've got a program called We Care going, which sounds good to me. Don't let go until you reach the top. I like your analogy. You know, like pulling a wagon up a hill, and then you drop it, and then you pull it back up a little further, and then you drop it, and you pull it back up a little further till you get there. And that's kind of a good analogy for chiropractic.
Well, in 1976 is when we started the We Care program in Pittsburgh. In fact, it went along with the Renaissance in Pittsburgh. When we came from court one day, we were down there on a case, and we were going through Hazelwood. And we decided that we'd set up an office in Hazelwood. And we felt that that place with the door fronts all boarded up needed a chiropractic office. So we did call the mayor at that time, and we asked him to send out someone, and he did. And we started this office in Hazelwood, and we tried to figure out what would be a good name to call an office in an area like that that was so run down it needed some renaissance. And we decided to call it We Care. And we have a little button here for you this morning, Don. It tells you about We Care. And we decided to call it the We Care Chiropractic Clinics. And We Care, we gave each one of the letters a meaning. And W stands for where, E for everyone, C can, A afford, R routine, and E examination. So We Care stands for where everyone can afford routine chiropractic examination.
How did it work?
It worked wonderful. Today we have over 300 offices internationally that does go along with this plan. And in the greater Pittsburgh area, we have some 25 offices in Southside and Hazelwood. And in fact, we're going to start a new office up in the Tremont in Mount Washington.
I heard that from somebody. Doc Pierce is going to Tremont because you bought a house up there.
Well, we bought a condominium there,
Okay.
and we decided that we'd like to have an office there, so on snowy days like yesterday, instead of going all the way to DeVosburg, we can just go down on the elevator.
Where will it be, Doc, in the building?
It will be on the second floor.
Okay, when do you open?
We hope to have a good open house on there about July 1st.
Oh, I see. Okay. And you're moving in personally, too?
Yes, we're going to move up onto the 14th floor, and we're going to have an office on the second floor.
That says you are a remarkable success in the business of chiropractic. But it must also say something about the modern science of chiropractic being something other than the old days, as you were indicating.
Oh yeah, that rack-em, crack-em type of chiropractic is a thing that's gone out. I mean, a person has no need to be in a chiropractor's office 3 and 4 times a week. He should go when he needs it, and you should, at any sign of any accident, any fall, or any time that you feel that your health is decreasing is a time to have your spine checked. It doesn't mean it's going to need a lot of chiropractic care. It depends on which phase of the degeneration the spine is in. Of course, if a person's young, up to 20 years old, it should be a matter of a short time to get him corrected. But once the spine is corrected, it should be checked routinely, just like an automobile, like you get your teeth checked twice a year. The spine should be checked. That doesn't mean it needs cracked. It doesn't mean it needs manipulated. It means it should be checked. And if there's a proof positive that there's a subluxation existing, then the adjustment should be given. But to rack and crack a body without rhyme or reason is not any good at all.
Let's take a look at some visuals that Doc's brought, some slides that will begin to help me understand. I see that is a spine. That is Yorick, and that's the bottom of him, and going up is the top of him.
Well, on looking at your left, that spine indicates a straight spine. And unless a spine has congenital abnormalities, which means that a patient has been born with some type of abnormality, the spine should be straight from front to back. And when you look at it from the side, that's the second picture, then you should have some curves. And there's actually 4 curves in the spine. You can only see 2 here because of the screen. But in the lower part of the back, down in the sacrum area, that's where you sit, it should curve to the back. Then you see the other curve, that's in your tummy area, it should curve to the front. And then the third curve you can also see there is curving to the back. Of course, the curve in the neck should curve to the front. So you should have 2 curves to the front and 2 to the back. And it's very important that these curves are there. Of course, the last picture over just shows you the spine from the back. Number 1 shows you the spine from the front, but of course that should be straight. I see that this one is upside down.
However, we'll move right along.
Yeah, we'll move right along there. Now, this shows you the upper curve of the spine, and it also shows you that there are those little black things are nerves coming out from the spinal column. And the things on the right is your heart, your lungs, your stomach, and your kidneys, and all your organs. Every one of your organs has to have a nerve supply. Many people feel that chiropractic care is just for a backache. But actually, chiropractic care, when it frees the nerves, it frees nerves going to every organ in your body. And it's very, very possible to help people with other problems other than back problems.
Makes sense.
Now, this is the lower curve, and that lower curve should curve to the front. And those curves have definite measurements, and we have rulers and ways to determine exactly if those are in normal range.
Mm-hmm.
Now, this shows you a perfect spine. At the bottom, we talk about the pelvis, and if we have time, then we'll get the spine out again and show you. But the picture on the right is a shot from front to back, and it shows a pelvic opening, and down at the very bottom there's little holes down there that are called obturators. They should be the same size and shape.
I remember that from last time, okay.
Right. And the pelvis, if you cut it in half, one half should lay over top the other half. And the picture on the left, of course, is showing you the lower curve of the spine from the side. Now, this is an abnormal spine. And here again, we can't quite see everything we want, but the holes at the bottom have become much larger. And the pelvic opening that we have listed as A there has become very smaller. And this would be what we call a PI pelvis, which is one of the most common type of pelvic problems. It means that the spine has gone back and down. PI means posterior and inferior. And when this happens, the next picture will show you that the curve will start being lost. And there the side curve is starting to straighten out. And instead of having a nice forward curve, you're having what we call a poker spine. And this is what would cause you the lumbago and the sciaticas and things like this that you mentioned before.
Happens. Okay. All right.
Now, this is an x-ray of that type of pelvis. You notice how those holes at the bottom, which we call obturators, appear much larger. And the pelvic opening, which is right above that, appears much smaller. See?
That's what your x-ray tells.
Absolutely. And then, of course, there's two different ways the spine will go. These curves will be lessened and the spine will become very, very straight. Or, in like older people where you start having humpbacks, that is the spine on the right. The curves become exaggerated. And these are not as common as the one on the left, but they too can cause problems. But a lot of those just come with old age as a person starts losing their spinal structure.
I think about you when I see the commercial for calcium of the old lady with the...
Well, yeah, you know, one of the best sources of calcium in the world is to just sprinkle a little bit of raw sesame seeds on your salad. It's much better to get the calcium the natural way than it is from pills. This way...
Sesame seeds.
Yeah. That's one of the finest sources of calcium.
Let's go back to the graphics for just a moment. Now, that intrigues me. I don't know what that is, Doc.
Well, this is a picture of the spine from the side, right between the shoulders. The one on the left shows that the curve is disappearing, and the one on the right is a patient that started to get some correction.
Oh. I see. Same view. Okay.
And these are pre and post x-rays. The spine on the left is where the pelvic opening becomes a lot larger, and the obturators, or the little holes at the bottom, become smaller. And then as we adjust this patient, the spine goes back to normal, and those little holes on the bottom and the pelvic opening comes back to normal. And these are the type of changes that should be seen in a chiropractor's office. A chiropractor should be able to say, this is what's wrong with you, this is what's causing it, I am going to do this, and when we're done, we are going to have a picture to show you the changes. But here, of course, it depends on the age of the patient on how much changes can be made, but there should be changes made on every sick person.
Ain't much hope for me, or is there, Doc?
Well, I think you could get a lot of relief under chiropractic care. I don't think you could get total correction, but I think you could get a lot of relief under chiropractic care.
I mean, some relief. How do you spell relief? Let's take a break on Talking Pittsburgh with Dr. Pierce. We'll be back with, among other things, Crime Solvers. Stay with us. We'll talk with Dr. Pierce just a little bit more this morning. He is indeed a leader in the whole science of chiropractic from a humble beginning in Dravosburg, and probably has advanced that science more than anybody else in America, I think. But let's get to Beaver County first. Chief Ovanik has a Crime Solvers report forthwith.
This week's Beaver County Crime Solvers case, in cooperation with the Economy Police Department, is seeking information leading to the arrest of the person responsible for the burglary and theft that occurred. The circumstances of crime are as follows. On December 29, 1986, between the hours of 10 a.m. and 8 p.m., unknown persons entered the victim's home by prying open a basement window, and once inside, the home was completely ransacked. The suspects removed a large amount of jewelry. Total loss value is over $26,000. All leads in this case have been exhausted and crime solvers need your help. Any information leading to the arrest of the person or person responsible for this crime will result in a reward of $1,000 being paid to the caller. The caller may remain anonymous if he or she desires. If you have any information, call Crime Solvers at 774-2000. Lesser rewards also being paid for information on other crimes. If you have any information on any crime, call Crime Solvers at 774-2000.
Wanted to do a book review of Doc Pierce's new book in a minute. He shares information with this thing, but one of the things he's done now, the rascal, has invented a table which looks very, very complicated. I suspect, Doc, its function is to be able to measure correctly.
No, this table is where the adjustment is given, and it makes it much more comfortable for the patient and much easier and much more effective. This is actually a large table. It weighs about 500 pounds, and all those knobs and stuff puts it in different positions so the patient will be more comfortable and the adjustment will be less painful.
Okay, so it isn't just to measure, it's to make the patient comfortable.
Yes.
Thank you, Dr. Pierce. I always learn something with you.
Well, thank you, Don. It was nice being on the program.
You're going to have a good time with your new house up in Drymont. Imagine that, a chiropractic office in Drymont. That's the advancing the state of the art.
Yes, it is. We're looking forward to it.
Thank you, Doctor. That's Talking Pittsburgh. We'll see you Sunday with Ron Graham, a Renaissance thinker, 7 a.m. Sunday. Be of good cheer. Have a nice day.